Hi, so this is one of my favorite cases, and it's a difficult case. So the ones who have got this correct deserve a pat on your back, or maybe a pizza. You can order a pizza for yourself. So yeah, the answer to this question is chondrocalcinosis. Why is it chondrocalcinosis and why not the other options? We'll look at it gradually. So anytime a patient is coming to you, a patient who is a drinker on most weekends, although the liver function tests may be initially absolutely normal, but a very high GGT, a good amount of raised bilirubin, and the fact that he's a drinker on most weekends, added with the fact that he's a diabetic, added to the fact that he's having hyperpigmentation that is explained by the tanned skin. So all of this leads to also the fact that he has sparse body hair may lead to presumptive diagnosis of liver cirrhosis in this patient. And in these patients of liver cirrhosis, a very, very common condition that we should suspect is hemochromatosis. And why am I going for hemochromatosis again? In hemochromatosis, the patients do have hypogonadism, and here we do have a case where the patient is saying that he is taking sildenafil for erectile dysfunction. So all of these combined, hemochromatosis is something which is very suspected, should be suspected in patients who are having features of liver cirrhosis. They are having associated diabetes mellitus and hypogonadism along with hyperpigmentation of the skin. In these patients, bilateral knee involvement is due to the presence of something which we call as pseudogout, wherein calcium pyrophosphate crystals are deposited in the joint spaces, leading to something called pseudogout or chondrocalcinosis. Why not osteomalacia? Osteomalacia won't come with bilateral knee swelling. It's usually asymptomatic. It can lead to fatigue, and it can lead to asymptomatic features like tenderness. It can lead to fragility, but it won't come with bilateral knee swelling as such. Coming to ochronosis, ochronosis is something that we find in patients of genetic disease called alkaptonuria, where the urine turns black on standing for a long time. And we have another option of gout. In gout, again, bilateral knee swelling is not a feature. Gout is usually unilateral. It will not involve bilateral large joints like the knee. Also, there is no history of a binge drinking due to alcohol. No alcohol binge drinking has been suspected in the question, which leaves out on the possibility of a gout. So we'll usually go in favor of hemochromatosis, and we can diagnose it by a liver biopsy, which will show deposition of iron, and the stain that is used to stain iron in the liver is what we call as Prussian blue stain, or the pearl stain. So Prussian blue stain or the pearl stain can be used as a diagnostic stain for confirming hemochromatosis. On a liver biopsy, we know hemochromatosis is a genetic disorder caused due to the mutations on the HFE gene, that's for hemochromatosis. And again, as I said, any patients with hypogonadism, diabetes, possibility of liver failure or cirrhosis, you should always think in terms of hemochromatosis, and try thinking that the joint deformities and the joint swellings are predominantly probably due to a chondrocalcinosis, that is due to the deposition of calcium pyrophosphate crystals. Thank you.